Hello, Dr. Braunstein. It is a pleasure to finally meet you. Could you start by first telling us a bit about yourself?
Sure, it's a pleasure to be here. I am a radiation oncology physician. I went to med school where I also got a PhD in cancer biology. And then after medical school, I did additional training specifically in radiation oncology to learn how to employ radiation therapy as part of interdisciplinary cancer care. So I work with a large team, but also work with folks in other cancer specialties such as medical oncology and surgical oncology. And together we work to help patients battle cancer.
Jumping right into today's topic, we're going to be talking about radiation therapy.
Mhm.
So, what is it and how does it work to treat cancer?
Radiation therapy, it's pretty special. It's a pretty unique therapy. Uh, in the panel of different therapies that are available to patients. It's essentially high energy light or particles that can be directed specifically at tumors to destroy cancer cells. When radiation is employed to destroy these tumor cells, we use very specialized machines or techniques to be able to do it in such a way that we target the tumor cells and try to not target any type of normal healthy tissue that surrounds the tumor cells. And what the radiation does, it damages these tumor cells so they can't grow and they can't divide, and then they die off over time. Usually, when we deliver radiation, we do it in combination with surgery and or chemotherapy. So we all work together as a team, and radiation is a big part of that.
So, there are several options when it comes to radiation therapy, and they each have their own benefits and drawbacks. What are the different types of radiation therapy that is used for pediatric cancer?
There are different types of radiation therapy that are used to treat pediatric cancer. And most radiation treatments are delivered with very specialized machines that use high energy X-rays or proton particles. And these are focused into tumor tissues. So these are created by very sophisticated machines that are designed to do essentially two things. One is to generate these high energy particles. The second thing is to be able to focus them and deliver them in a very specific way to just treat target tissues, target tumor. These machines do that with a combination of specialized imaging. So often, in addition to getting treatment, they're able to take pictures right before treatment or during treatment to make sure that they are on target. Because it's very critical that when we treat, we're really just treating the target area and not the rest of the healthy body. So most patients will get this form of radiation, what we call external beam radiation, which is photon or proton therapy. They're both equally effective at targeting tumor tissues and destroying cancer cells. In some cases, protons may be slightly better in terms of their ability to deliver very focused radiation just to select areas, but that's not always the case. In addition to those two types of therapy, photons and protons, which are part of external beam radiation therapy, there's some types of radiation therapy that can be injected or infused through an IV into the bloodstream, which can then travel to all different parts of the body and work in a more systemic fashion.
Finally, do you have any additional advice for patients considering this form of cancer therapy?
I think when you meet with your special cancer team, which may be composed of surgeons and radiation oncologists and medical oncologists, there's a lot of discussion. Each one of us have our area of expertise, and we're working together to come up with the best treatment plan for each patient. And I think you'll find when you're meeting with each of the physicians, they have a lot of information and a lot of expertise. And there's a lot of information available to you as a patient. So my advice is to seek out that information, to ask lots of questions. Sometimes in the moment when you're meeting with a physician or nurse and the team, you may not have those questions readily available, but you should take the time when the questions come up to write them down and then send them to the team when you have the opportunity. If you're coming in for radiation, you're coming in every day. You have the opportunity to meet with the team almost every day that you're getting treated. And there's lots of information and resources available. Sometimes it's pamphlets or books or websites. Sometimes it's group discussions. But I think it's very important with all these different therapies for patients to be able to get the information they need to feel comfortable. And I certainly hope that this video interview helps to contribute to that so that you feel well informed, and hopefully it sets aside a lot of fears that come with a new form of therapy.
Thank you so much, Dr. Braunstein, for joining us. I believe that is all the questions that we have for today.